incredibly important, isn't it?
Yes, it's very important. One of the most telling things that I look at is that when I started out in medicine, there were 183,000 colon and rectal cancers a year in the United States. We're down to 140,000. And I look at the landscape, and have we improved our diet? Probably not. Have we improved our exercise? Certainly not. What have we done? We've increased the number of doctors doing colonoscopy, and we've increased the number of colonoscopies. There's not a one-to-one correlation, and I can't prove my assertion, but my assertion is that colon and rectal cancer screening, especially colonoscopy, has reduced the incidence of colon and rectal cancer in the United States.
And even though the number's down, there still are a substantial number of fatalities connected to this.
Yes, there's about 60,000 fatalities every year out of 140,000 new cases. It affects 1 out of 20 people in the United States. It's the second most common cause of cancer death in the United States.
What age should men and women start thinking about getting colonoscopies?
It's very important to realize that even without risk factors, you should start screening at age 50.
Okay. Now, you mentioned diet. What should we be thinking in terms of diet to help ourselves?
High fiber diet, diet high in folate, green leafy vegetables.
And what about those like Benefiber capsules and things like that? Do you find those help at all or not really?
If you can't get your fiber any other way, my own recommendation to patients is to use a powdered fiber supplement. I think it works better. When I'm treating patients for anorectal disease and they need more fiber in their diet, I think it seems to work better in my patients to use the powder, but any way you can get the fiber is good.
And you also mentioned exercise. There's a direct connection between the amount of exercise you get and the decreased likelihood of this.
Yes, sir.
And what should we be doing? How much exercise?
About 20 minutes 4 or 5 times a week.
Okay. Again, it's one of those things people may not like to talk about, but it's an ugly disease, and it's something that, as you say, we've seen a decline in. Let's hope we can keep those trends going.
That's what we're here for.
And if people have information or questions, I should say, where can they get some information?
They can go to their primary care physician. Certainly they can contact me at Woodland Healthcare, but they can go to their primary care physician. If they know a gastroenterologist, they can go to a gastroenterologist. There's an excellent group of colon and rectal surgeons here in Sacramento that they can get information from. And then the American Cancer Society website or the website of the American Society of Colon and Rectal Surgeons.
And we should mention the colonoscopy itself, you don't even feel it. The worst part, the day before,
yes,
right,
sir.
Doc? What do you have to do the day before?
There's several different preps. The most common prep is you have to drink a gallon of liquid. And
what goes in must come out.
Yes, sir.
And boy, it comes out and comes out. Doctor,
yes,
we're having a little bit of fun.
Thank you very much.
But it's a serious subject. We thank you so much for shedding some light on this.
Thanks for having me.
All right, Monica, you still got a long ways to go before you don't have to worry about that. She's a young pup.
You know what, though? It runs in my family, so I'm always trying to keep aware and all the latest things that come out with that. I also try to read up on it as much as possible. So thanks so much to the doctors for coming in early this morning and enlightening us on that. Here's a look at our weather forecast starting you off.